Do you have low back pain that's not coming from a disc or that doesn't have any nerve impingement, but you still have back pain? Maybe it's a muscle. And the primary muscle of the low back that causes low back pain is called the Quadratus lumborum. Here's a picture of it. It goes from the bottom of that rib cage, the last rib, all the way inserts into the top of the iliac crest, which is where you place your hands on your hips. Its primary motion is to side bend. So when somebody has a trigger point or they're irritated in that muscle, it will create this hitching effect and they'll be stuck here. So let me show you how to unstick it. Your hip bones, slide up, use your thumbs and find the outer ridge. Once you can pinpoint the area of tenderness, place a tennis ball there. Once you find the tender area, place the ball, lay on it, extend, and elevate the leg. The psoas muscle is another major player when it comes to acute and chronic low back pain. To release the psoas, find the front of the hip bone. Slide your fingers into your abdomen where it gets fleshy, and place a heavy object into the area of tenderness. Here I am using the edge of a kettlebell. You can internally and externally rotate or slide your leg. This is a release of the psoas while you're lying on your belly. Find that same tender area, grab a tennis ball. Place the tennis ball right in the tender spot. Lie on your belly on the tennis ball and roll your hips over the ball for a self-myofascial release. To increase the stretch and the compression, bend your knee and internally and externally rotate your leg. This is called nerve flossing, and this is great for anyone with sciatica-like symptoms down into the glute, the hamstring, the calf, and the foot. Start by mobilizing your neck down and up. Then find your hip structure sliding up and back onto your sits bones. Once you come up into an erect position, take the leg, extend the knee, and point and flex the foot. Putting all those motions together will create a nerve gliding or sliding of the sciatic nerve from the low back to the leg. Here is a series of extension exercises good for those with disc-related sciatica-like pain. Start by relaxing your lower body. Place your hands directly underneath your shoulders and do a baby cobra. If you feel some stiffness, do a few more. As you progress, gently move yourself up into full extension.